Origins of cystic fibrosis lung disease. Definition. Cystic fibrosis is an autosomal recessive disease caused by mutations in the gene encoding the cystic fibrosis transmembrane conductance regulator, CFTR. At the clinical level, that chronic bacterial airway infection, prominent neutrophilic inflammation, mucus obstruct airways, and progressive bronchiectasis characterize advanced cystic fibrosis lung disease, which causes more cystic fibrosis morbidity and mortality.
With every breath, we draw bacteria and other microorganisms into our lungs. Our airways are lined with airway surface liquid, or ASL, composed of periciliary liquid and mucus that traps debris. Hair-like structures called cilia sweep ASL, clearing debris and protecting against obstruction, infection, and inflammation. A protein called Cystic Fibrosis Transmembrane Conductance Regulator, or CFTR, lines the apical membrane of epithelial cells and transports chloride into ASL. Chloride and sodium in ASL attract water. In patients with cystic fibrosis, various CFTR mutations impair chloride transport, causing sodium and water to leave ASL, thus dehydrating airway mucus. The dehydrated mucus flattens cilia and creates an environment suitable for obstruction, infection, and inflammation.
Application in medicine. Over the past 2 decades, investigators have studied people with cystic fibrosis who have disease-causing CFTR mutations. At progressively early time points, by 3 years of age, bronchiectasis is present in nearly 1 in 3 children with cystic fibrosis, although the host defense defects that trigger infection continue to be debated. Understanding the initial host defense defects in cystic fibrosis airways could suggest novel preventions and treatments and the means to assess disease status and efficacy of therapeutics. Implementation of universal newborn cystic fibrosis screening and potential new therapeutics that target CFTR further emphasize the need to elucidate the origins of this disease.
Cystic fibrosis, or CF, is a genetic disease that affects multiple organs, including your lungs, and limits your ability to breathe over time. Your main airway, called the trachea, branches into each of your lungs. The largest airway within each lung is called the bronchus, and each bronchus branches into smaller airways called bronchioles. Normally, airways are coated inside with a thin layer of fluid and mucus. The mucus catches dust and germs from the air you breathe in. Then, hair-like projections on the airway surface, called cilia, push the mucus, trap dust, and germs out of the lungs. In cystic fibrosis, the mucus is so thick and sticky that the cilia can't push it out of your lungs. This thick, sticky mucus can build up, trap germs like bacteria, and block your airways. Because of this, you may periodically have acute infections or exacerbations of the disease, causing symptoms such as increased coughing, production of mucus, and shortness of breath. As the disease progresses, long-term damage can occur in your lungs. This happens when germs, like bacteria, get into your lungs and cause chronic infections and inflammation. But there's a lot you can do to control the infections and slow the progression of lung damage. Talk to your CF Care team about how the different parts of your treatment plan can help keep you healthier. As your partner, they can help you find ways to fit your treatments into your daily care routine.
Pros and cons. In pros, we have to move in the even earlier time points might be revealed the origins of cystic fibrosis lung disease and thereby change clinical practice. And in cons, Before symptom onset, pulmonary inflammation and infection are often present, although which comes first has been uncertain. Cystic fibrosis alters the electrophysical properties across airways epithelia and the access to newborn organs and tissue, and the invasive in vivo and ex vivo experimental intervention required to elucidate the pathogenesis are impossible in humans. Issue applied in Ecuador. In Ecuador, it is estimated that 1 out of every 11,252 live birth, 29 new cases per year present cystic fibrosis, CF, genetic disease without cure and with lifelong treatment. This is revealed by the project of early diagnosis of cystic fibrosis developed by the Faculty of Medical Science of the Universidad Central del Ecuador. This research stated that at least 10% of cases can be identified at birth if the test is performed within neonatal screening. And in conclusion, these discoveries in cystic fibrosis may also have implications for other diseases. Sensitive assays could potentially identify and quantify early host defense defects and track disease progression and therapeutic interventions.